Yes. Normally, I would have sat with you all, and you will see some talk shows that I have on the net. When you check me out later, I'm sitting with you on the table, but I didn't prepare this now with the stand, so I have to do it as an interview. Start. I am Reverend Dr. Thompson Ntuba, the Chief Editor of Health and Development Magazine, and we are at the Convention Center, downtown Washington, D.C., this Sunday of May 2017 as part of the American Thoracic Society International Annual Conference, and we are at the ATS Global Health Pavilion. With me is
Dr. Jacqueline from Kenya.
And Dr. Akwo from Nigeria.
Oh, beautiful people. What did you say was your first name again?
Jacqueline, Dr. Jacqueline.
Jacqueline. And? Ogona. Meredith? Marilyn. Lovely. Why did you do medicine?
I did medicine because I lost a close relative due to lack of treatment, and then I was very naive, so I thought if I became a doctor, probably I would be able to treat all the diseases in the world. I think that gave me motivation. I later came to learn it doesn't happen like that, but I love the profession. Yeah.
Dr. Oguna, I saw you on the big screen yesterday during the gala of the foundation, and everybody was wondering who is this black man. I'm sure everybody went away with the assumption that that must be an African American. What do you have to tell people who may not know who you are, where you come from, why you were on the screen, and what makes your university that gave you your medical degree unique and different?
Okay, to start off, I actually won a grant from the American Thoracic Society, which is actually trying to evaluate an innovative training capacity, research capacity program they have, which I think is what even brought me up here. The university where I work where I work back home, it's called University of Calabar Teaching Hospital. I schooled in Ebonyi State University, Abakaliki. That was where I was trained. That's where I did my medical training. But currently I'm rounding up my specialist training at the University of Calabar Teaching Hospital. So what happened was, when you asked her why did she decide to go into medicine, mine is a little bit different. I think it was just because back home in the secondary school I went to, if you were smart, either you went into engineering or medicine. So I naturally tilted towards medicine.
Lovely. Marilyn?
The reason why I came into medicine is I think I was just passionate about medicine, especially children. So as it is, I'm actually training to become a pediatrician in South Africa at the University of KwaZulu-Natal. So it's passion more than anything else.
Global health actually is misunderstood by a lot of physicians. To many, global health is public health. To others, global health is medicine. To others, global health is psychology. To others, global health is sociology. To others, global health is social anthropology. But to those who know global health, we have inputs from all or many other disciplines which make global health very unique. In global health, we have prevention, healing, and promotional health. Now, why do you think that you are here talking about global health when you are actually physicians and many would take you for public health practitioners? What makes physicians talk about global health when they are not actually public health practitioners? Maybe we should start with you, doctor, in the middle.
Well, it's quite interesting the question you asked because I'm training to be a community health physician, which is like a public health and preventive medicine specialist in some climes. The truth is, if you look at the world, what happens in one place affects every other part. Just like currently we are talking about things like climate change, which is now a very, very topical issue. A lot of what has been attributed to be the cause of climate change primarily comes from more of the industrialized countries. But back home in most African countries, as they would agree with me, even though people may not exactly know what is happening, but they could tell you that the weather around them, the seasons have all changed. The pattern of the way things used to be has totally changed. It's no longer the way it was before. And so you see, we're now interconnected, just like when the Ebola crisis broke out. It started in one component, and before you knew it, it was happening in Spain, it was there in the US. So potentially, with the world being connected now, even with air travel, you see that the whole thing about health is now a global issue.
Yes, the issues of health are today global in scope. And let's look at one of those health issues which are pretty global in scope. Cigarette smoking and its complications, or the risk that it presents to the formation of pathology in the chest, in the lungs, the respiratory system, in the thoracic cavity and its related tissues. So let's talk a little bit about cigarette smoking, COPD or chronic obstructive lung diseases, bronchitis, bronchiectasis, emphysema, bronchogenic carcinoma. Doc, what are some of the things that you would say from a global context that cigarette is doing to people, and 1, 2, 3, you can advise them to prevent the harm from cigarettes?
I think cigarette smoking is a very, very wide topic, and as Dr. Ogona has said, that these are some of the issues that affect the global community. Well, some countries or continents are more affected than others. Like in Africa, South Africa has a lot more smoking as compared to like my country, which is Kenya. And there's a little bit of variation in terms of the exposure and the risk, but it's still a problem. I mean, globally. We have more of indoor air pollution, which will cause the same effects almost to smoking. So we may not have a lot of smokers, but we definitely have a lot of indoor air pollution. And so things like COPD and emphysema, they are a global problem despite the causative agent, basically. So there's a lot of variation.
And what will you do? What will you advise as preventive measures? 1, 2.
Preventive, interestingly, it's interesting you've asked that question, because as much as we say that prevention is a cure and we need to educate people, there's a study that was just done in Nigeria recently that they were looking at, do people really know the effects of smoking? And the study showed that they actually know the effects of smoking, and they've actually been cancelled against stopping the smoking, but they don't do it. So I think we need to look at a different way of doing things.
What are you going to do, 1, 2, in order to help people stop or prevent them from smoking?
Education.
Go ahead, I'm listening. Education, 2?
Education.
Yes.
And I think the core of it is mostly education. Yeah.
We are still on the subject of cigarettes, nicotine, air, because the end point and emphasis of these meetings is to help you breathe, right? There are women out there who are pregnant and they are smoking. They may not even know the consequences of cigarettes to themselves as pregnant women and to their unborn child. So, with all your experience, what are you saying? What does cigarettes do to the unborn child? And what advice do you have to the mother, Doc?
Okay, thank you for that question. It's quite interesting that, from a pediatric point of view, once a mother decides to smoke during pregnancy, that has effects on the unborn child. Certainly things like intrauterine growth restriction, some people may not know, but the effect of the smoke on the fetal placental circulation results in complications that are related to the growth of the baby in utero, and also in terms of when the child is born. I've had in my experience people who've come and say, my child is asthmatic, but I smoke outside of the house. But as soon as they finish smoking, they pick up the child. And knowing that the nicotine particles actually adhere to the clothing, and once they pick up the child, they inadvertently expose this child to passive smoking. So you get issues with acute exacerbations of asthma in children who are asthmatic, reactive airways diseases as well. And that sort of causes all the complications that are related to difficulties in breathing from a very young age, and as the kids grow, things like distraction of the ciliary, the cilia in the respiratory tract, and that predisposes them to other infections. It could be viral infections or even bacterial infections, and that also impacts, in the long term, on the growth of these kids.
So what are you telling the women? What should they do?
They must just stop smoking.
Thank you very much. Okay, we are now entering the last phase. Last phase is simple, just what I said. I will start with you, Doc. Why are you here? Please, we already have about 12 minutes recorded. I don't want the video to go beyond 13 minutes. So you have just 20 seconds to talk. Why are you here? How will others who are not here benefit from what you're benefiting? The same question too. Okay.
Very, very good thing or outstanding thing about the American Thoracic Society is its push towards raising a generation of top-notch researchers. And I believe that's one of the key things I get to gain here, and mentorship and a lot of collaborative work. For instance, working with the American Thoracic Society has gotten me to be able to publish in a top-notch journal, which ordinarily may not have been quite easy that way. So it kind of creates a platform for us to be able to go beyond our limitations.
Doc, so tell me, you've basically listened to the sessions, the plenary. Anthony Fauci, the director of Infectious Disease Institute at the National Institute of Health, did a wonderful presentation today telling us about HIV/AIDS, Ebola, Zika, and all of those. Now, what is it about some of these benefits we are getting, besides others that you know that I don't know, that are making you to want to talk to your friends to come to the next meeting?
Simple. Collaboration, networking.
Wonderful. Doc, I can imagine the people of South Africa and the other nations where all of us are from just so excited that we could come together and discuss, around this table, and then have this video, pushed out there through the magazine for them to also benefit from your expertise. Now tell me, there are people who doubt. There are even many who are like, those are white man things. Why should we be involved? What do you have to demystify the notion that some of these international meetings, though they happen in the West, in America, in Canada, in Europe, are not actually for white people alone? They can benefit African physicians. What are you saying to the African physicians who are not here, and why they should be here at the next meeting?
It's a global village. That's all I can say to them. It's a global village, and the amount of exposure that we get from a meeting like this